The next group is Yukon University, Lyris, Mark, and Michelle. Can you just introduce your group and while we're getting the slides?
Oh, sure.
Yeah.
Okay.
Thanks.
Thanks. Thank you, everyone. Really happy for us to present today. You won't need to listen to me for long. Mark's going to do the bulk of the presentation. My name is Lyris Smith. I am one of the team working on this project, as well as Mark Christopher, Michelle Leach, who's here with us. We also have Cody McGinnis, who lives and works in Dawson City. We are also, this is our second slide, so I'll move ahead. We have an advisory committee on this project who've been very active, and we have members of the Yukon Medical Association, Yukon Registered Nurses Association, Yukon Licensed Practical Nurses Association, and 2 people lived experience, one of which is with us today, Kat. So we're really excited to do this presentation about the perceptions of COVID-19 with the Yukon's frontline healthcare workers. So we can actually go to the third slide, I think. So why we think this is important is, I mean, everyone knows that COVID-19 has had a significant impact on people's mental wellness, as well as causing burnout in many sectors, and that's very true of the healthcare sector. In particular, there's healthcare workers that are leaving the profession or have already left the profession, and that's very concerning. And we really wanted to look at a much more localized level to see what are those impacts in rural, remote, and northern healthcare. Next slide. So this is our project design. With the time restrictions, we had to limit to nurses and physicians, not because we didn't think that other healthcare workers were impacted or had a really important voice. It was just related to scoping the project. So there's 2 phases in our project. The first one was a survey, the Copenhagen Burnout Inventory, which has been used in different sectors, particularly service like sectors like healthcare and education. And we had 141 respondents, and we analyzed that based on gender, profession, and work location. We're going to give you a snapshot of that, but we're going to focus on phase 2 today, which is our in-depth interviews of 38 professionals. And we did a thematic analysis, a qualitative analysis on that, and looked at different themes that Mark will take you through. So I'll hand it over to Mark to talk about the phases.
Thank you, Lyris. So I'm really excited to share the findings from this project with you. So beginning with our phase 1, the CBI survey. Next slide. So there's 3 subscales. The first subscale is looking at personal burnout, and here we saw high levels of personal burnout across the total sample, with 50% or more of people reporting that they always or often feel worn out, tired, physically and emotionally exhausted. The next subscale, work-related burnout. Again, we saw high levels of work-related burnout with over 60% of the total sample selecting to a high or very high degree when asked if their work is emotionally exhausting. And then lastly, client-related burnout. Here we saw relatively low levels compared to the first 2 subscales, moderate to low levels of client-related burnout. When asked if they find their work frustrating, or their work with clients frustrating or hard, nearly 50% of the sample selected to a low or very low degree. So the key findings from phase 1, we had high levels of personal and work-related burnout and relatively low levels of client-related burnout. Interestingly, community healthcare workers experienced slightly higher levels of client-related burnout compared to those working in Whitehorse. And then we also saw that females and nurses were disproportionately affected. These 2 groups reported the highest levels of burnout across all 3 subscales on the CBI. So moving into phase 2, the in-depth interviews. This provides a bit of a follow-up to the burnout survey findings. It allowed us to understand the individual perspectives of frontline healthcare workers and to determine some of the factors that have contributed to the high levels of burnout and work stress. And then it also gave us a really good opportunity to speak with people and hear about what they think needs to be done to support the healthcare workforce and bolster the territorial's health systems capacity to respond to future pandemics and health emergencies. So here we did our thematic analysis, and we had 4 major themes emerge. Those 4 themes: personal effects, work-related effects, client effects, and the territorial response. So as I go through this presentation, I'll talk about each of the sub-themes that emerged from the major themes, and I'll provide a little bit more detail on that. So beginning with personal effects, the 4 sub-themes that emerged, we had social life and hobbies, mental wellness, relationships and childcare, and life decisions. So a lot of people reported the loss of social life and feeling that they didn't have an outlet to deal with a lot of their work stress, which kind of ties into the adverse impacts on mental health that many people talked about. And in terms of those impacts, a lot of people talked about seeking therapy and counseling, as well as support from friends and family. And then also, many people felt that they had to adapt their hobbies to do things independently so that they could stay safe and still follow COVID guidelines, but still, again, have that kind of way to decompress from working in a highly stressful environment. This kind of ties in a little bit to the relationships and childcare piece. A lot of people talked about the strain that being a frontline healthcare worker had on their relationships with their partners, their children, and their immediate family. And then other people also talked about leaning on their immediate family for much needed support throughout the pandemic. So that was a little variable. In terms of childcare, the lack of support for childcare was something that a lot of people brought up. We see that in Canada, if we look at nurses, over 90% of nurses are female. And this was something that really affected female workers who were unable to work from home. And then that was compounded by having a partner who was also considered essential. So people had to kind of choose between whose job was more important. And when schools closed down, anyone with school-age children really struggled with that. And then there's also the perceived risk of being exposed to COVID that their family and friends experienced. So a lot of people had family and friends who would normally look after their kids, say, no, we don't want to do that. We're uncomfortable with the level of risk. And a lot of these 3 sub-themes kind of tie into the 4th one, life decisions. We found that people's desire to achieve better work-life balance and to prioritize their mental health contributed to them making really significant life decisions. So whether that's career changes, a few people talked about moving to the territory to escape the state of the pandemic that existed in southern jurisdictions. And then they also talked about like leaving the hospital, working to switch to long-term care, so moving to a new facility and finding a new role to help reduce the level of work stress that they experienced. And a quote that really speaks to this: "But it's hard not to see the connection between pandemic-associated burnout and the fact that people are just leaving the profession or not picking up the extra shifts. A large trend of people either moving away from nursing or cutting the hours significantly, which is, of course, adding to some of the strains on the system. But if I don't, it's just a matter of time till I leave the field altogether." And something that on a previous slide that Lyris went over, we've seen that in nurses in BC and Ontario, approximately 30% are intending or have considered thinking about leaving the profession within the next 2 years after the pandemic. So this is, again, a really important finding and speaks to some of the staffing shortages that already exist in the northern or territorial healthcare system. And then the next big theme, work-related effects. The sub-themes that emerged here, we had work environment and workload, communication and COVID policies, and ineffective system. So when we look at workload, a lot of people reported a significant increase in workload. A lot of people were working extended hours, logging a lot of overtime. There's also issues with absenteeism due to some of the COVID rules. When people have cold-like symptoms or they have a close contact, they're not allowed to come to work, which contributes to the ongoing staffing issues. And then one thing that a lot of people talked about was the added workload and time and energy that it takes to put on all of their PPE, go in to see a patient, and then have to take all of that off, put on new PPE, and then go and see another patient. So that really impacted their ability to deliver timely care. And then moving on, another thing that added a lot of frustration and workload, keeping up with rapidly changing COVID policies. things were always changing. People talked about it being really hard to keep up with that and being really frustrating, that they would come into work one day and policies would say one thing, and then they'd go home, come back the next day, and then it would be completely different. So just being able to, or being required to adapt to that, and then often navigating unclear communication or communication that lacked transparency, both from employers or managers and at the level of the government and things like that. And then lastly, this was kind of the biggest sub-theme for work-related effects. People talked about the system being broken or ineffective. And a lot of this really boiled down to limited resources. So when we talk about resources, as I've mentioned, staffing is a really big one, so human resources, but also the availability of PPE. And when we talk about PPE, this also created a lot of safety concerns because people not only felt that they didn't have the appropriate PPE, but they felt that what was often available might not have been as effective. So that obviously brings safety concerns from not only exposing themselves to COVID, also their loved ones and their patients. And then in terms of capacity, another really big one that people talked about, several people mentioned that the territorial health system at the beginning of the pandemic or pre-pandemic was already operating at 100% capacity. So it was already vulnerable to a pandemic. And when the pandemic hit, it really, a lot of people described it as a bit of a tipping point. And then finally, and this would, I'd say, is the one that jumped out the most to our research team, was the lack of support for healthcare workers. People felt really undervalued and underappreciated, whether that was the lack of support from their employers, managers, professional bodies, or the government. And one quote that really speaks to this and the impact that support has on the healthcare workforce's capacity to respond to the pandemic. You can work hard and you can work long hours if you feel like you're supported and that everyone's in it together and there's resources coming, like there's willingness to support you. You can't work like that when you feel like management is telling you to do more with less because there's no help coming and the burden keeps getting put on the backs of the frontline staff. Moving on to the client-related effects, the sub-themes that emerged here, we had access to care, relationships with patients, and also the moral distress and emotional burden experienced by healthcare workers. So we look at access to care. This was, a lot of people talked about delayed or canceled surgeries, routine screenings, public health programs. So we look at that from a patient's perspective. Often they were unable to access the necessary services throughout the pandemic. And then moving on, relationships with patients and clients. This is one that really jumped out to me. People were really frustrated with COVID mandates, isolation restrictions, or visitor restrictions and things like that. And often they projected this anger and frustration onto frontline healthcare workers. A lot of frontline healthcare workers described feeling that they're the face of these mandates and decisions that they really weren't even a part of. And that was really, really challenging for frontline healthcare workers. People are talking about getting coughed on, people are getting spat on, they're getting threatened, and people are like backing them into corners and things like that. And those are things that like come straight from this research. So just dealing with really frustrated and angry patients, but also trying to like maintain compassion and empathy and provide them with optimal care was really challenging for people. And when we look at it again from the provider's perspective, feeling that they had limited resources and they had to enforce a lot of COVID policies, specifically things like visitor restrictions around big life events, whether it's the end of life or the birth of a child, and having to enforce visitor restrictions to say, hey, like, sorry, you can't be with your loved one right now because either you weren't vaccinated or there's a limit of like 2 people to come visit. That created a lot of moral distress and emotional burden on frontline staff. And one quote that kind of speaks to this piece and the provision of suboptimal care. Patients or clients are very sensitive to one's approach. And when you have 15 other things that you're behind on, you just physically cannot prioritize bringing in that calm, compassionate energy. And it impacts your patient care. You don't make rapport with your patients. You don't catch on to things as quickly as you may have in the past. You know you're overworked and you're tired. You're not sharp and clear. And when you don't have that emotional desire to do better, you become complacent, or you just get the bare minimum done so you can just get home. The last major theme, I'll make this quick because I think I'm running out of time. Territorial response. We asked people what their thoughts were on the territory's response to the pandemic. Sub-themes that emerged here, positives or benefits to the territory's response. Mandates, specifically COVID vaccine mandates, was a big one that stood out. The organization of vaccine clinics, assessment centers, isolation facilities, and there was particular frustration within the communities for how the government supported these processes. Communication to the public and to healthcare workers. A lot of people talked about the lack of transparency, inconsistency. I know other people have talked about Dr. Hanley and the CMOH and his communication style, and like the impact that switching between all the different CMOHs had. Like, they felt that no one was asking for their feedback, and there's people above the front line who are making all these decisions but have never actually worked on the front line or like know what's happening on the ground. So that was something that was really important. And then back to the mandates piece, this was another thing that kind of jumped out to us, and just talking about the impacts of the vaccine mandate on the healthcare workforce and the work environment. So a quote to kind of talk about that. The vaccine mandates, like, I have no problem with that, but I don't know. I know across Canada that was the norm, and I'm a team player, but I don't like that some people that worked there for 20 years lost their jobs, had no income. So that just kind of speaks to the fact that a lot of people, even though they might have complied with getting the vaccine, felt pressured or coerced into choosing between their livelihood and getting the vaccine. And I think I might be out of time. Okay, well, yeah. Can I wrap this up quickly? All right, so just looking at all of the highlights from phase 2, challenges related to childcare, especially burdensome on females. A lot of the work-related effects came down to systemic issues. A lot of people experienced moral distress related to the provision of suboptimal care, and we saw that communication affected all of the major themes. Thank you to the Yukon government for funding this, and for all of our partners, the 3 professional organizations, Yukon Hospital Corp, Yukon University, and all the advisors. Without your help and support throughout this project, it really wouldn't have been possible, so thank you very much.
Thank you. That was awesome work.